Right now, somewhere in a hospital, a surgeon is scrubbing their hands before cutting into a human body. They have anesthesia, sterile tools, antibiotics, and a team. They have everything modern medicine spent centuries building. And still, surgery is considered one of the most complex things one human being can do to another. Now imagine doing it without any of that. No metal tools, no germ theory, no understanding of infection. Just stone, fire, and whatever your hands had learned to do. Someone did exactly that. And the patient lived. This is not a myth. This is not an interpretation. The evidence is sitting in a museum right now, and it changes everything we think we know about when humans became capable of deliberate, sophisticated thought. In 2022, a team of archaeologists excavating a limestone cave in Borneo made a discovery that stopped the field cold. They found the skeletal remains of a young person, estimated to have died around 31,000 years ago. The bones were largely intact, but the left lower leg was missing. Not broken, not torn, not showing the jagged fracture pattern of an accident or animal attack. The bone had been cut, cleanly, deliberately, with precision that left smooth edges and a specific angle that could only have been produced by someone who knew what they were doing. The study was published in Nature. The lead researcher, Tim Maloney of Griffith University, described it as the earliest known evidence of surgical amputation in the human record. Not the earliest attempt, the earliest successful one. Here is what makes that word successful matter. The person did not die on the spot. The skeleton shows clear evidence of healing. New bone had grown over the cut site. Osteophytes, small bony projections the body produces during recovery, had formed along the wound edge. This individual lived for years after the operation. They survived the surgery itself, survived the infection risk, survived the recovery, and continued living in a hunter-gatherer environment with one leg. In Borneo, in the rainforest, 31,000 years ago, someone kept them alive long enough to heal. That means the surgeon understood enough about the body to cut without killing. And the community understood enough about care to support someone who could no longer hunt or gather at full capacity. That second part is the detail that never makes the headlines. The surgery is shocking, but the survival is the real evidence. Because survival required more than a skilled hand. It required a group of people who decided this individual was worth keeping alive even when they couldn't contribute equally. Archaeologists call this evidence of care. It sounds clinical. What it actually means is that 31,000 years ago, in a cave in Borneo, a group of humans looked at one of their own in pain and made a choice. We are going to save this person. We are going to carry them if we have to. That decision is not instinct. That decision is civilization. But here is where the story gets darker. Because Borneo is not the only site, and 31,000 years ago is not the only date. In 2018, researchers re-examined a skull found decades earlier in France from a site called Baume-Molagursi, dated to roughly 100,000 years ago. The skull showed evidence of trepanation, a hole deliberately cut into the cranium, with the same healed bone growth indicating the person survived the procedure. Trepanation is one of the oldest known surgical practices in human history. It involves cutting or drilling through the skull, usually to relieve pressure, treat head injuries, or in some interpretations, release whatever the community believed was trapped inside. It requires understanding that the brain exists. It requires knowing that you can cut into a human head without immediately killing them if you do it correctly. Someone 100,000 years ago knew that, and they were right. The oldest confirmed trepanned skull with survival evidence currently dates to approximately 7,000 years ago from a site in France called Insisheim. But specimens keep appearing. In Ukraine, in Russia, in Peru, in China. The pattern is global, and it is old. What this tells researchers is not that surgery was invented once and spread. It tells them that multiple human groups, independently, across different continents and different millennia, arrived at the same conclusion. That you could open the human body deliberately, intervene in what was happening inside, and close it again. And that doing so was worth the risk to both the surgeon and the patient. The question nobody has satisfactorily answered is how they knew. How does a person with no written knowledge, no anatomical diagrams, no prior medical tradition reach the conclusion that cutting into a skull or removing a limb will help rather than kill? The leading theory is accumulated observational knowledge passed down through generations verbally. Someone watched enough injuries. Someone noticed that a certain kind of wound healed differently than another. Someone eventually made the leap from observation to intervention. That leap required not just intelligence, but a specific kind of courage that we rarely credit to people we call primitive. They were not experimenting randomly. The healed bones prove they were succeeding. What the Borneo discovery specifically dismantled was a quiet assumption embedded in almost every history textbook ever written. The assumption that complex, abstract, technical thought arrived late. That it came with writing, with cities, with bronze, with everything we call civilization. The bones in that cave say otherwise. They say that 31,000 years ago, before agriculture, before pottery, before any of the markers we use to define human advancement, someone looked at a shattered leg and thought, I can fix this. And then they did. We spent centuries assuming that the further back you go, the simpler the mind. The limestone caves of Borneo just made that assumption very difficult to hold. The surgeon who saved that life left no name, no record, no monument. Just a healed bone in the dark, waiting 31,000 years for someone to find it and understand what it meant. We are not the first humans to be capable of remarkable things. We are just the first ones who wrote it down. Everything before that was not silence. It was just a different kind of record. And the bones are still talking.